I'd like to welcome everybody. Good that you were able to join us. Our numbers might increase as we go through our together. I'm Margaret Fisher. I'm one of the midwifery team, associate professor in midwifery here at the university, and I have with me Leanne and Emma, who are second and third year midwifery students respectively. You will meet them more presently because we're going to do some breakout groups. You'll have one of each of them in your breakout room and be able to really chat amongst yourselves about anything that you want to related to this particular session. So welcome, and call this session Midwifery is about more than delivering babies. But I'm going to ask you to start contributing now, so don't sit all silent behind your cameras. Do feel free to turn them on, and please turn your microphones on to be able to tell us what you think a midwife does. Any offers? Don't be shy. Come on, one from each of you. Then that's only eight options.
Postnatal care.
Okay, postnatal care, lovely. Another volunteer? Come on, one for each of you.
Advocating for women.
Brilliant, like that one. Advocating for women, yep.
Caring for the family and the baby and the mother after delivery.
Great, I love the fact you've enjoyed oh God, try again. I love the fact you have involved the family there as well. So family, mother and baby, brilliant.
Yeah, just supporting the whole family with it, and then the mother especially.
Lovely. So again, that recognition of the wider family. It's not just the woman, it's not just the baby. It is that wider family. Great. Any other volunteers?
Someone's microphone isn't working, but they've said feeding support after birth.
Brilliant. Feeding support after birth. That's lovely.
Providing evidence-based information. Brilliant.
Wonderful. You're giving some fantastic answers here. There's a bit we've left out complete. Well, actually, two bits. Just say it's not only about delivering babies, but actually you can be involved at birth. And what's the other bit that we've left out? Because there's been quite a lot actually about postnatal and feeding and caring for mother and baby.
Antenatal.
Antenatal, yeah, absolutely. During the pregnancy, pretty important that bit. Goes on for 9 months. So just short of 9 months, shall we say, that the midwife is involved. So we've got antenatal.
Breastfeeding support.
Sorry, breastfeeding support. Yep, great. Because feeding may not just be breastfeeding. And I think whoever it was, sorry, I've only got four faces on my screen, so I can't tell who said the previous one about feeding. I think you said a more general feeding, and yes, breastfeeding, absolutely. Anybody else? Do you think we work alone?
Liaising with other services that might need to get involved, such as social services or any other healthcare professionals, such as paediatricians, consultants.
Lovely, great. So that multidisciplinary team role and engaging with others. We're not little islands working on our own at all. Yeah, so the concept of teamwork is really important, isn't it? On the other hand, there is quite a lot of independent working as well. So it's that ability to work either as teams or independently. So I've got a slide here that shows lots of pictures, just kind of giving an idea of what you might do. And this is all in one day, okay, as a midwife. So it's not a question of you're only going to be looking after antenatal women or you're only going to be in labour ward or whatever. The way that midwifery goes now, and there's something called better births, and the models of care that have changed as a result of that means that there's a lot of more integrated working where midwives may be in the community, maybe in the hospital, may work flexibly between them in one day or between different days, or you may have some who are more fixed in one area than another, but there's a lot more interchanging going on, and the very fact that potentially you're moving between environments means that the care you're giving may well change. So you may do an antenatal clinic in the morning, you may then do some record keeping and maybe write in some booking history notes or something along those lines. You may have to attend a meeting as well, possibly a lunchtime meeting, take your sandwiches. Obviously at the moment all these are on screen, or a lot of them are, even in the trust settings. They're not having quite so many face-to-face meetings at the moment, but hopefully those will start up again. Or maybe a teaching session or something like that, and then possibly you're going to go into labour. Well, not you personally. You're going to go into the labour ward in the afternoon because maybe one of your ladies has been called in and has gone into labour, and you may care for her, and she may either have a nice normal birth or she may end up with a cesarean section. And then, yes, you may well help with that feeding afterwards. And all along, you're going to be following the code, the NMC code, Nursing Midwifery Council code, because that's what dictates everything we need to be doing and following as professionals. For nurses and for midwives, we have our own midwifery standards that we have to follow. And as students, you would need to meet certain requirements for proficiencies that you had to gain in order to become a registered midwife. But you'd be doing all of these things in order to gradually build up that knowledge, the skills, the experience, to be able to become that registered midwife at the end. There are a couple of other little pictures in here which show a clock and somebody multitasking. And I think multitasking is a pretty important part of being a midwife. And I'm sure when you go into breakout groups shortly, you'll hear from Emma and Leanne that actually, you do need to be able to juggle things, whether it's caring for the woman in labour while writing those notes and making sure that they're as detailed as possible, because other people rely on them to give continuity of care, and also because you need that record of what's been done, or whether you're juggling trying to be in an antenatal clinic at the same time the phone goes and somebody else is calling in with some issue. You're having to write your records in the clinics as well, and these are now becoming increasingly electronic. And then of course you have your own private lives, and you have to be juggling that along with being the midwife. And as a student, you're also having to juggle your theory. So there's a lot of bouncing of balls going around, a lot of spinning of plates. And I think if you are interested in midwifery, you need to be very prepared to be pretty busy, and need to juggle these balls. You need to be flexible, adaptable, because each day you go in, you're going to face something very, very different. You may go into an environment you're familiar with, but you don't know who's going to come through the door, and you don't know what they're going to need when they come through the door, and all sorts of unexpected things can happen. But that's the joy, I think, of working with people anyway, and in the healthcare professions, is that actually no 2 days are the same. I think that's how some of us are struggling at the moment, of sitting in one chair at one computer, and I've been doing this for the last year. Students are lucky, they get out into placement. We're stuck here. But it is lovely having that variety. And so if you are somebody who likes a bit of variety in life, likes not always quite knowing what's going to be happening, then it might be that midwifery is for you. And I think one of the key things is you need to be interested in people. You need to be having them at the centre of your thoughts. You need to be wanting to provide an excellent service. You need to want to try to be making women's experiences as positive as they can be. They're not always happy. You will encounter some challenging situations, but it's remembering that you have them at the centre the whole time. But as several of you rightly pointed out, it's not only the woman, it's the woman and her fetus while the little one is in utero. That is a model, by the way. It's not a woman with a split hip. So called a fetus when it's in utero, or the baby obviously when it's born. And then you have that family unit, which can look like all sorts of things. And we need to be completely non-discriminatory, non-judgmental about what that family comprises. But again, as people have pointed out, it's that ability to also work in that wider team, that multidisciplinary team, maybe engaging with social services and so on, because unfortunately not everybody has the most straightforward time that we might want them to have. So I think I'm going to stop there. Oh no, I'm not. I've got to show this slide before we go into the breakout groups. If you were thinking in terms of doing midwifery in the Southwest, so with the University of Plymouth, I have included this slide. If you do come along to open days and things, you'll see the same slide, and we kind of go on a bit more about placements. But I just want you, before you go into breakout groups, to kind of be able to picture things, because it might be that you want to ask either Emma or Leanne some specific questions about the area itself. So what we have is 7 maternity units, and in your midwifery program, half your program is in practice and half your program is in theory. And when you're in the placement setting in your practice, about half the time will be in the maternity units of the hospital, and about half the time out in the community area. And that can cover quite a large area, which makes it interesting, but also can make it challenging when it comes to the travel, especially as we don't have great public transport. So we've got these 7 units. Starting from the east, we've got Yeovil, which is quite a small unit, tends to be slightly lower risk, so they haven't got highly intensive special care units for babies and things, so they can only take women from certain pregnancy, certain gestation onwards. But that's Yeovil is one of them. Then we have Taunton, which is quite a big unit, hospital setting, and all the community kind of goes around this area in Somerset. We've then got coming down the road Exeter, which obviously is a reasonable sized city. So you've got that going out to the moors, going down to the East Devon area, and then down to Teignmouth Dawlish area. You've got Torquay, which picks up Teignmouth Dawlish, goes across to the moors, goes down to, oopsie, didn't mean to do that one yet, I clicked, down to South Hams, to all of that area. Plymouth, big city centre, goes up to the moors as well, goes just across the border into Cornwall. And then you've got Truro, can't see Truro, where's Truro gone? Where's Truro? Must be on this map. Can't not be on the map. Am I blind, somebody? It's somewhere down here, isn't it? How extraordinary, it's not on this map. Either that or I've gone blind. Anyway, Truro is where the main hospital is, Trelisk, and it's, I think it's this side of it rather than the other. Now it's confused me as to where Truro is. And essentially all of Cornwall is the community area that can be covered there. And then we go up to North Devon, up in Barnstaple. Oh, we don't have Barnstaple on this one either. Well, Barnstaple's up, oh yes we do, there we are. Barnstaple's up here. And you've got all that sort of North Devon area there. So we've got these 7 units: Yeovil, Taunton, Exeter, Torquay, Plymouth, Truro, wherever it is. And now I feel hopeless not being able to find that Truro, and North Devon, Barnstaple area, and covering the whole southwest area. So it's a big geographic area with a lot of different sort of types of client base, as it were, depending on where people live. They'd have access to different facilities. There may be certain folk who've sort of always stayed in the same rural area, and others who live in cities and are more used to moving around, and therefore along with them come all sorts of different psychosocial issues, and that's all makes life really interesting. So those are our 7 different units. Those are the photos there show the different maternity units, all of which are located in main hospitals, but they have their own departments. I'm just going to draw this to a close now because I'm conscious of the time. And just, I will show these last 2 slides because I know that obviously some of you are clearly quite au fait with what you think you're coming into, but just in case we've got anybody in the group who hasn't really felt that, may not be feeling sort of quite the same and quite as ready, or to everybody, it's just reiterating that really what we're looking for is those individuals who have got those central cores of woman-centered, person-centered care, enthusiastic. We want caring midwives, compassionate midwives. These are the 6 C's that were brought out a number of years ago. Jane Cummings, the Chief Nursing Officer, actually brought these out into the arena, and they are cited quite a lot because actually what they're saying is really important. So the care, the compassion, the competence. Yes, you all need to get to a certain level of competence, ability, to be able to demonstrate those proficiencies so that you can go onto the register, and you need to maintain that competence. Communication, absolutely paramount in midwifery right the way through, whether it's the communication between the midwife and the woman or her family, or whether it's between other midwives or other staff members or whoever, the general public. Communication is really paramount. I think what Emma was describing there, and we've been talking about, was courage, that we do sometimes have to stand up and we have to speak out and be prepared to do so, because it is woman-centered care we're providing, and we need to be very committed. So all those discussions you were having in your groups before about travels and the finances and the juggling of balls and the everything else, it's that bit about actually, yes, it is going to take quite a lot from you. And then just finishing off with that concept of, okay, well, what do I do in between? Yes, you may not work in a healthcare environment, but I think it's reassuring you that whatever experiences you can gain in life, and yes, we have said you need to have some sort of work experience, but it's not only work, it's all those other things. Think about what skills you're developing by doing them. And you may look at some of these pictures and think, yeah, well, they're way away, waitress, what's that got to do with being a midwife? Rugby player, female rugby player? I don't know, we may have some males in this group, not sure, haven't really looked at the names. What's that got to do with it? And think in terms of what we talked about, that team working, the multidisciplinary team working. Think in terms of the fact that, the waitress is actually helping the public have as positive experience as possible, learning those communication skills with complete strangers, putting the customer first. All of that is very much linked with midwifery. So think broadly about what you've done in the past and what your life has brought you. You don't have to have given birth. You don't have to have seen a birth. You just need to bring with you whatever experiences you've got, draw on those skills, and the rest of them you will learn as you come into midwifery and as you undertake the programme, if you choose to do so, and we would love to have you. So we have had questions so far, so I'm not actually going to sort of pop that one up, but just to say thank you very much for attending to everybody. obviously, if you are thinking of joining us, depending on when you're planning to do it and depending on what happens with beloved COVID, there may or may not be the opportunities to go to open days, or we were running applicant days, which was for people who'd already got places on the course. So this, I suppose, you're saying, you know, some of you have actually got places. For you, this is kind of the equivalent of an applicant day, that we would talk a little bit more about the course itself, but you never know, we might manage to have a proper one, a real life face-to-face one before you come on the programme. But otherwise, do have a look at the website, look at our programme. We will be running new ones from September. So the actual content of the curriculum will be a little bit different, but at the end of the day, everything leads to becoming a midwife. So what you read online will be very, very similar. And yeah, good luck, enjoy, and hopefully see you for your interviews in due course if you haven't had them already. And if you have got a place on the course, we look forward to seeing you in September.